All right, thank you very much, Professor Ite and then Professor La. Um, it's a pleasure really to be with you today. And um, the Pro Vice Chancellor, Research and Innovation and Development in the University of Ghana, the project investigators for meals for NCDs, the project advisory board, the colleagues from the University of Ghana, distinguished ladies and gentlemen, good day. It's really a great opportunity to be part of this meeting. And first of all, I really want to express my appreciation to the Meals for NCDs project team and stakeholders for their resolve to fight nutrition-related NCDs, not just in Ghana, but in Africa. NCDs, as we know, affect us all. However, the rate at which they are increasing in sub-Saharan Africa is of great concern. A report by the Institute of Health Metrics and Evaluation in the University of Washington actually showed that the rates of obesity has increased by 1,400% in Burkina Faso. And like said earlier, 500% in Ghana. And we are also seeing the same trend in Togo and Benin. The report further indicates that 8 out of the 20 countries in the world with the fastest growing rates of adult obesity are in Africa. So clearly, there is an urgent need for us to take decisive action against NCDs on the continent. Unfortunately, the high-level continental nutrition and health policies and strategies, for example, the 2003 Maputo Commitment, the 2014 Malabo Declaration, the Africa Region Nutrition Strategy, and the Agenda 2063 have all focused on addressing the continent of hunger and food insecurity. Overnutrition is not given the attention it deserves. And unless the problem of overnutrition is effectively contained, the vision that we have would remain elusive. That there is really the need for policy impacting evidence, which both local and regional policymakers are able to make to combat NCDs in Africa. The existing policies basically have been informed by evidence from high-income countries and have paid little attention to the African food environment. Against this background, the Meals for NCD project and the Food Environment Research Network Initiative first seeks to connect researchers in the Africa sub-region and the global north whose work relates directly or indirectly to improving food environment in low and middle income countries, and second, to build capacity and generate context-relevant evidence. Ladies and gentlemen, there are countries that are already doing well in the fight against nutrition-related NCDs. The two things that have been observed to be common in these countries are one, the context-relevant evidence, and two, political commitment. For example, in Chile, there are regulations and laws preventing advertising of unhealthy foods on TV to children under 14. In Spain, there is legislation requiring that kindergarten and schools are free from all advertising. In Argentina, there is the mandatory maximum levels of sodium in various food products. In South Korea, there are zoning laws which are being enforced in what they refer to as the green zones. And this basically looks at bans the sale of food that is deemed unhealthy. In Fiji, there are reduced taxes on healthy foods. There's removal of excise duty on imported fruits, vegetables, and legumes. In Mexico, they are implementing a 10% tax on sugary drinks and 8% tax on unhealthy snack food. In Africa, South Africa has really taken the leadership and has imposed 20% tax or 2.29 cents per gram of sugar in sugar-sweetened beverages. So all these actions are important, and as clearly outlined by the Director General of the World Health Organization, Dr. Tedros, he said, and I quote, "If we are to win the war against premature death caused by NCDs, we must also win the battle in our kitchens, shops, supermarkets, restaurants, and schools. We must make it easier for people to make healthy choices, and we must make it harder for unhealthy choices. End of quote. Our duty as researchers is to ensure that we generate the evidence needed to fight this war. Commendably, this is exactly what the Meals for NCD project aims to do, providing measurement, evaluation, accountability, and leadership support for obesity, NCD prevention in Africa. On this note, I wish you all a successful meeting as I declare this laudable initiative officially launched. Thank you, merci, obrigado, asante sana, nagode, medasi.